our next panel, everybody's on deck. Uh, you know, I gotta give a huge shout out to um, the team of people working on this conference that you don't see on camera. You know, our behind the scenes crew, making sure that our panelists are up and ready and everybody's here. And so I am going to hand it off. If you can bring her up, our panelist for this next um, panel is Dr. Lakia Wilson. Dr. Wilson, I haven't seen you in a couple of days. Good morning. Good
Good
morning.
morning.
She's kind of like she has like 9 jobs at Rochester Regional Health. Or did they promote you this morning again? You know,
Not today, not today.
not
Maybe
today.
tomorrow.
Good morning, Dr. Wilson. And this next panel is going to be about racial trauma and community mental health. And Dr. Wilson, I hand it over to you. And good morning to all of your panelists, and welcome to ABC's Signature Conference.
Thank you so much, Mr. Underwood. That was a powerful conversation on greenlining, and I honestly think you guys could have done another hour on such an important topic because we're going to keep hitting on that over and over again for our community. It's definitely a hard act to follow, but I'm going to try. So, as Mr. Underwood mentioned, I am Dr. Lakia Wilson, and today we're going to do our racial trauma and community mental health panel. So, racial trauma refers to the emotional impact of stress related to racism, racial discrimination, race related stressors, such as being affected by stereotypes, hurtful comments, microaggressions, or barriers to advancement. So, I pride myself in being a community pediatrician and intentionally being present where our youth are, from my office, from the hospital, to schools, the community, to our youth detention centers. Our BIPOC and Indigenous youth have less access to mental health services. And I always start off with a disclaimer that I'm not a therapist, I am not a psychiatrist, but I will work with the youth, and I have many community partners that do the good work. And so I am excited and honored to introduce our panel today. So to begin, we have Miss Arlene Wilson, who is the Senior Director of Programs for the Alzheimer's Association of Rochester and the Finger Lakes region. We have Gerald Johnson, who is a senior rehabilitation therapist and coordinator of case management at URMC Pediatric Behavioral Health and Wellness Outpatient Clinic. We have Dr. Anne-Marie Mikowski, who's an adult psychiatrist at Excellus Blue Cross Blue Shield. We also have Mr. Kendall Scott Jr., the Director of Native American Future Stewards Program at RIT. We have Aubrey Bell, who's a licensed mental health counselor working with youth and families at URMC. And last but not least, we have the esteemed Reverend Dr. Melanie J. Silas Chandler, who has many different titles, but today she will wear the hat of founder and CEO of Breathe Deep Incorporated. All right. So we will move off to our first question, and we will start off with Miss Wilson with the Alzheimer's Association. Looking at research data, caregiver burnout and stress is often present when caring for loved ones with Alzheimer's or other chronic health conditions. How can we better support the mental health well-being of our caregivers?
Great question. So first, I wanted to start with a little background. And Alzheimer's is part of a continuum of dementia. Dementia is the general term. Alzheimer's is one type. There's other types: Lewy body, frontal temporal, vascular, Huntington's, and mixed. And Alzheimer's is a brain disease that causes problems with memory, thinking, and behavior. It's progressive, no cure, and it's ultimately fatal. And so our research shows that African Americans are twice as likely as whites to develop dementia in all of those forms. And we are more likely to want to care for our own people at home or keep them in their home. And so that's a lot of stress on us. And so it's important that we understand the risks that come with this disease and what we can do. So Alzheimer correlates with a lot of the health issues that you see in communities of color: cardiovascular, the health disparities, poverty, racism, environmental pollution. I like to say they correlate with Alzheimer's and dementia, but they're not causes. But what I do see is we have some positive examples in youth, particularly the millennials and Gen Z. And I like to shout out Simone Biles and Naomi Osaka, two young ladies who were very open about talking about their stress, talking about their mental health, and the importance of stepping away from what they're doing to take care of themselves. So, what we can do for those who are caregivers, and as people of color, if there's 5 people in a room, 4 of them have somebody in their family, in their circle with dementia and Alzheimer's. It's just that prevalent. We need to listen and we need to talk about what's going on in our lives. There is no uh, heroics. There's nothing to be gained by hiding things, by not sharing what's going on. And you may gain insights and supports from people and places you don't know. And so, as we talk about things, what I've got 4 points. One, you need to develop your circle of support. And I'm looking at some of the people in the panel, and I know they have aunties they go to, grandmas, they got besties, they're members of book clubs, they're members of sororities, fraternities, organizations that they can go to their folks. They can go to people and talk about what's going on and get support, get encouragement, and get words of wisdom and advice. We also need to develop strategies of personal support. And so we kind of have pushed this off, but we have to kind of go back to old school. We need to exercise. I know we say, oh, exercise. Who wants to exercise? Exercise is good for your mental health. Exercise is good for your stress. Okay. I was preparing for this morning. I was a little nervous and I said, should I skip my exercise? No, I'm going to work out. And I felt better after I work out. Meditation. There's all kind of great apps now that can really help with meditation. And meditation has become cultural. So you can find an app with people of color giving you words of encouragement, words of support. Okay. And then old school, go for a car ride, go for a walk. It takes down the stress, it takes down the pressure. And then eating those veggies, and young people, now they do the green juices. Get you some green juices. Okay. So you get those nutrients. If you don't like to chew your vegetables, drink your vegetables. Okay. And then strategies, what I call cultural supports. Okay, so that's church, that's prayer, that's the coming together of groups, fraternal organizations. And what this conference started out with, music. I was here early because I love that playlist. That playlist is fire. You got my motivational songs. Everybody should have a motivational songs playlist to get you through the hard times, to encourage you, to bring good memories back. And then the professional supports. And that's who we have on this panel. We need counselors. We need to know what support groups are available for the issues we're going through. And we need education. We need to read a book. You're too busy to read a book, get a book on tape and listen to that book when you walk in, when you're doing laundry, when you're doing dishes. Educate yourself about these health issues so we don't go to those extreme positions of hurting ourselves. We're going through it. It's a tough time. And it's always going to be something we're going through, but we have to reach out and find those supports.
Amazing. Thank you. Thank you so much. What I took away from that was having a theme song. So in the morning, for me to get motivated, I have all types of music saying, I can do this. I'm going to be the best me. I love the music. We have the greatest playlist every year. Greatest playlist.
Yes, yes.
All right. Thank you for that. Okay, Mr. Johnson, your first question for the morning. From your experience as a care coordinated manager within the Community Mental Health Center, how can we improve opportunities for advancing mental health wellness and engaging Black and Brown families utilizing non-traditional modalities?
First, thank you for having me. So what we've been trying to do, what I personally believe in, is that, you know, that engagement piece is very, very, very important, and how we engage our families of color. And I think really what I've been doing here with our work at U of R is really making sure that we put the family at the center, but for non-traditional ways of really making sure that we are engaging families, understanding cultural backgrounds, understanding, you know, the tradition, or incorporating their cultural traditions into their sessions, utilizing apps, utilizing the barbershops, right? So those non-traditional ways, like barbershop, families, the pastor, the mosque, utilizing community leaders that could also bridge the gap as well. So use these non-traditional ways. A coach, a football coach, could be a non-traditional way. Whoever this family or this kiddo has identified as a strength or a person that's important in their life, we can utilize them in non-traditional ways. I think we get so caught up in, you know, certain type of therapy, DBT, CBT, all that stuff is great. But I think there's non-traditional ways. And I'm grateful now that we have apps that's available for families. And I think it's very important too for us as we utilize these non-traditional ways. It opens up doors for us to share and talk about more about mental health and to normalize it more in our community. You know, I often tell folks that if I broke my arm, I could go to the doctor. Everybody's like, "Oh, you go get that taken care of. You know, get a cast, get some pain pills or whatever." But when something's going on with me mentally, we look at it like it's different, like we separate that from the body. And I think that is important as we continue to utilize non-traditional ways, having somebody you can talk to, somebody you can go to, having community-based approaches, you know, like I said, engaging community leaders, trusted figures within the mental health, the discussions, to have activities, make it normalized at churches and temples and mosques, talk about it in the communities. We, as a community liaison, as of one of my roles, I make sure that I go out to the community, especially Black and Brown communities, and I'm talking about mental health. I'm talking about normalizing it, you know, checking on your mental health, checking in with your family. I think if we could normalize it and utilize, you know, like I said, community-based approaches, incorporate cultural traditions into engagement. She talked about earlier about exercising, right? Having that mind-body practice, the spiritual and faith-based support. And then technology, those mental health apps, telehealth services now has been a plus that for families who cannot get out and families don't have the transportation, utilizing that. So telehealth is a non-traditional way. The apps is a non-traditional way, but also just connecting with folks in your community, your hairdresser, your barber, just talking. You know, I know for me, that's a great outlet. I'm able to go to my barber and just talk, and we could, you know, as we say, chop it up, right? We could just chop it up, and then I could feel better because I'm able to leave talking about some of the things and we could relate. So, and then peer support. I think having somebody that you know, that has gone through and has faced and has overcome some mental health challenges is one way to overcome. We could advance the non-traditional modality in children's mental health.
Awesome, Mr. Johnson. I agree with you wholeheartedly. And as you were speaking, the one thing that really was in the back of my head was the biopsychosocial model. And what is our social sphere? Who is in our social network? How do we define who we are and making sure that's an asset-based approach? And again, another theme that was repeated from Ms. Johnson as well is listen, talk, shared our lived experiences, talking about mental health and normalizing it using our supports within our community. Fantastic. So we're going to move on to Dr. Makowski with Excellus Blue Cross Blue Shield. Your first question for this morning. While leading Excellus Blue Cross Blue Shield Behavioral Health Services, what are some of the equity-centered system level and community level strategies or policies that you have prioritized?
So I do have to say, we are very much a team. We have a lot of internal collaboration, you know, not just the medical directors, but all levels here, case managers, our advocacy and outreach. So we really have tried to prioritize taking an integrated approach with mental and physical health. And when we are looking at things, we're always trying to look at, you know, what are the barriers that exist from all different sources? We try to look at those system barriers, the insufficiencies in the care processes. How can we make things more efficient? Clinical barriers, where are there lacks of resources? Where are we not connecting as a plan in supporting people? Patient-related barriers, we talk about social determinants of health, lack of stable housing, transportation. How can we facilitate these things so people get the care they need? And then, the provider-related barriers. We're also trying to keep an eye on that, because certainly we know providers and systems get very stressed, and there could be inadequate time or a lack of expertise for certain areas. So how we gather that data, how we look at it internally, it may not sound very exciting, but both that big level so that we can come up with solutions that are going to affect the most members, and then also that micro level. So one thing that we do weekly, we have a few different case conferences. As medical directors in the health plan, we meet with case managers and talk about some of our highest risk, most vulnerable members. Specifically, what services they're needing at the time, and how can we outreach and be effective, and where might there be a gap? Where is something that might be missing? And how can we as a health plan assist them with that? So even on that very basic human member by member level. And I don't think people really realize that some of that goes on behind the scenes, but really taking big macro looks at things, and then also the individual member looks, because at the end of the day, we live in the community. These are we are members of the health plan too, as employees, and so it's important that we have a healthy community and do this for our neighbors. So that is one way that we've really tried to address this. Some of the specific things, really, I think focusing on like maternal health and postpartum depression, we've really tried to work on establishing the routine depression screenings, because we know from a mental health perspective how important that maternal health and postpartum period is. We have things like Project Teach, which we try to promote, some of these wonderful programs that are available, and making sure that our providers can use these services to help support new moms and babies. So really trying to work on reducing the risk with substance use. And we've had some really great outreach. We've gotten feedback from the community. Kind of last year at this time, there were some really high opioid related crisis deaths going on in the Rochester community. We really tried to look at that information and spotlight education to try and help people understand opiate use disorders, how to use medications like Narcan for emergencies, what are the resources that are available. So really we try to take that feedback and help to get information out to our members effectively as quickly as we can.
Awesome. I think that's, we want to thank you for definitely sharing some of the things that happens at Excellus that the community may not know, that integrated approach and looking at barriers from all angles and different lenses. And I think it's really, really important for us to look at the barriers of care and access, especially for our women, our mothers. They are, everyone comes from a mom, right? And we need to really take care of the women population and making sure that we address all those barriers so that they can have a healthy life, a healthy pregnancy, and have healthy children. Thank you for that. Mr. Scott, you are up next. Your question for the morning. Research has shown that first-generation college students present on college campuses with significant amounts of stress and anxiety. We also know that trying to excel in a non-inclusive environment impacts one's mental health. What prevention practices can be implemented to safeguard these students' mental health on college campuses and workplaces in general?
Thank you, Dr. Wilson. Like you said, research consistently shows that first generation college students face significant challenges, including academic pressure, culture, cultural disconnection, and navigating unfair systems. These challenges are often compounded by non-inclusive environments, which can lead to stress, anxiety, and a lack of belonging. To address this, institutions need to prioritize mental health by fostering inclusivity and providing holistic support systems. First, I believe that they should have culturally responsive counseling services, which are critical. Institutions should hire mental health professionals who understand the diverse cultural backgrounds and experiences, having counselors who share similar cultural identities and are who are more culturally appropriate approaches make a significant difference. I feel like students need to feel seen, heard, and understood. It's very important here in Native American communities that are so small on college campuses that we do feel seen. Secondly, I believe that there should be a mentorship and peer support programs, which are essential. We can pair first generation students with mentors or peer groups that can help them navigate academic and social support systems and face challenges while creating a sense of community. These programs provide a safe space for students to share their struggles, seek advice, feel less isolated. And third, I think institutions need to provide more cultural wellness programs. I used to work at Bacone College, which is the first American Indian college dedicated to supporting American Indian students, which is similar to HBCUs. And if you didn't know that American Indians face 50% more mental health needs than any other group. And at the time, we were dealing with some suicides on campus. And I want to address that. So what we did is we integrated cultural practices like sweat lodges, drum circles, and stickball games. And these activities not only connected students with their heritage, but also provided spaces for healing and grounding. And I think universities and workplaces can replicate similar approaches by celebrating cultural diversity through workshops, events, and community-based building activities. Finally, proactive communication is key. Students must know where to access resources like tutoring, financial aid, and mental health support. Normalizing help-seeking behavior through outreach and awareness campaigns can help reduce stigma and encourage students to use resources available to them. I'm a first-generation college student, and I didn't know anything about navigating higher education. And there was a program called TRIO, and I was too afraid to ask for help, so I didn't do too well in my first semester. But when I found out TRIO was on campus and it was for low-income first-generation students, it opened me up to be more confident, to asking questions and asking for help and seeking anything that I need, the only challenge that I faced, and it was very supportive of me. And by creating an inclusive and supportive environment, we can help first-generation students thrive both academically and emotionally, ensuring that their mental health is prioritized.
Amazing. Thank you so much for that. As I asked the question, I was hoping that you would address the experience and what was being put in place for our Native American students, and you did that. And so I want to ask you a second part of the question, kind of putting you on the spot. What can we do as a community to help more support these endeavors, such as students are applying to colleges and universities, identifying these social groups, mentors, or peers? Is that a way that we can help allowing them to be more successful and having a sense of community on campus?
Yeah, so as we know, they face these unique challenges stemming from systemic inequalities, environmental stressors, and intergenerational trauma. But we can address these issues with culturally rooted, community-centered approaches that support both individuals and families. We can integrate traditional healing practices with modern mental health approaches. For Indigenous youth and families, cultural connection is a source of resilience. Programs can incorporate practices like sweat lodges, talking circles, and land-based activities to help individuals reconnect with their identity and heritage. Something that we started doing on the RIT campus was we discovered some Seneca trails that were on campus that were used hundreds of years ago, and we cleared the path out, and we had these tours, and we had these walking circles, and we talked about what was going on in our communities and how we could support each other, and it was very beneficial. And the students really wanted more physical activity, so we had this event called Waxing and Learning. Lacrosse is called the Creators Game, and it was very positive for the students to practice lacrosse and connect with the Haudenosaunee stories and just to listen and feel like they were part of the community. These practices paired well with modern therapies and create a holistic approach to mental health. I also believe that we need to strengthen family and community support systems. In many BIPOC and Indigenous cultures, family and communities are essential to well-being. Providing family-centered workshops or educational programs about mental health and addiction can reduce stigma, promote collective healing. For instance, we invited elders to these storytelling sessions on campus, and we do community gatherings to help reinforce cultural values and relationships. And we address these systemic barriers like environmental stressors, like housing insecurity or limited access to healthcare, which cannot be ignored. That's why Common Ground Health and the Indigenous Health Coalition were very supportive and helped us out by connecting us with these elders. And I feel like institutions should partner with local governments, nonprofits, and tribal organizations to address these groups. This includes advocating for equitable policies to increase our access to culturally competent behavioral health services, and create programs that alleviate economic stressors. And finally, I think we should empower youth through leadership and advocacy opportunities. By giving BIPOC and Indigenous youth a platform to lead and advocate for communities, we build resilience and a sense of agency. For example, the Land Stewardship Program or activism workshops that can channel their experiences into positive action, helping them grow while contributing to the communities. We do that here at RIT by helping out with the STAMP project. We have students there doing environmental research to help the tribe to reduce damage that's done to the environment with the STAMP project. And by addressing these both as structural and cultural factors impacting mental health, we can create an environment that fosters healing, resilience, and empowerment for BIPOC and Indigenous youth and families.
Thank you for that. I really love the walking circles, being grounded to Mother Earth, and using that as part of the healing and support system. That is amazing. Thank you so much for that. All right, Ms. Ball, you're up next. So your first question of the morning. What are some of the cultural responsive engagement and treatment tools that you apply when engaging BIPOC youth and families?
Yeah, so I'm going to echo what a lot of other folks have already shared and just kind of premising some of these interventions. And it's that healing is relational. At the end of the day, we heal inside of our communities. And so knowing that 70% of the getting better from therapy happens because of your connection to your therapist, we have to understand that at the base level and recognize that's the most important piece. So with that in mind, when we serve other folks that are different from us, certainly it's possible people can get better in those circumstances. But what we know is it's so much better for people to be supported by people who look like them, who are from their communities, who understand their cultural background. So if there is not a clinician match in that way, it's up to the therapist to really do that education, learn what's available in the community, learn how different cultures come to therapy in general. There's a hierarchy that exists in almost anywhere you go in the medical field. And so when we go to the doctor for an ailment, we're really expecting an answer or a prescription, and most Western therapies aren't like that. So being able to provide education and an open, honest engagement in the discussion of what someone wants from therapy, to be able to provide that. So first and foremost, one of the things that I do is I acknowledge those differences that might exist. I think that honesty and we talked about earlier, having sometimes those uncomfortable conversations, really, pushing white clinicians in particular, that this isn't uncomfortable. This is necessary in order to build these trusting relationships. And providing education and acknowledgement of where therapy has been over the course of time. Psychology therapy has created a lot of harm in underserved and BIPOC communities. The research that's been done, we can't even begin to appreciate how harmful it was for the lack of informed consent, the dangers that have been provided. And so while we're much differently located now as a supportive healing service, we're not that far away from it. 75, 100 years ago, even 25 years ago, when we also look at the LGBTQIA plus community, that identity was seen as a disorder. So really recognizing that within the system. And then ultimately acknowledging the barriers that have been mentioned as well. Cost, access, transportation. A lot of those barriers have been addressed and met in some of the clinics in our area. You know, there are programs that exist, medical motors going through insurance, but there's not as much of that in private practice. And since we know that the relationship is most important, it can be really difficult in those clinic settings with high turnovers before a lot of clinicians end up in private practice. So acknowledging those barriers, encouraging more resources within the private practice world for therapists as well. And certainly we talk a lot about resilience for young people, for families, for the BIPOC community, and it's absolutely crucial. And it shouldn't be up to those folks to build the skills to be resilient to the harm that's continued to be inflicted upon them by our systems and sometimes by our clinicians. So doing things like being a part of youth mental health first aid, being able to offer that free to the community, where any community member can come and learn about the signs, the symptoms of a mental health crisis and learn how to intervene supportively, get connected to services that are both formal and informal, like peer supports or community leaders. I mean, there's so many things we could go on and on. I could at least, but the role of school counselors and therapy in schools, the biggest piece is really building trust, education, and relationships.
Thank you. Thank you. I really love that healing is relational. I wrote that down and underlined it 3 times. I think that is really key. And I think it's important to acknowledge the harm that we've already caused, right? And then holding our mental health therapists and our providers accountable for educating themselves about our cultural differences and not putting it on our clients. I think that is paramount. Thank you. Thank you so much for that. So we're going to move on to Reverend Dr. Silas Chandler. Your first question for the morning. Since founding Breathe Deep, I flipped it over, you have served hundreds of youth, giving them tools and a platform not only to learn about mental health and wellness, but also to engage and support other youth. Without giving away your trade secrets, please share with us a few lessons learned regarding improving the mental health of young people you have worked with.
Well, good morning, everyone. It's still morning, right? Good morning. And I just want to first say thank you to Jerome Underwood and his team at ABC for inviting me to this platform. The conference has been awesome. I logged on last week and I'm here for some more of the conference later on today. And I just have to say thank you, Dr. Wilson, for that beautiful introduction earlier. You know, I love the work that I do, but I'm also very personally connected to the work that I do. I'm a child or a daughter of a mother who developed schizophrenia when I was a young person. So at the age of 5, by the time I was 5, my mom had already developed schizophrenia. And so the work that I do with youth really is an extension of that. I wanted to create spaces and resources that I did not have as a young person growing up, dealing with mental health stuff, dealing with trauma, but not having the resources or the access to care or self-care or education. And I think that when I look at our peer ambassadors, our 14 to 17-year-olds, so when you think about these youth, they're 14, they're 9th graders, the majority of them all the way up to 11th grade, and some seniors. They have a voice. And I think that one of the lessons learned in terms of helping them to identify and to tap into that is to give them permission. I think that most times we need permission to really be be present with ourselves, to understand what we want, what we need, and how we move forward from there. So I would say lesson number one is to give them permission to acknowledge that they have a voice, give them permission to utilize their voice, let them talk. Please let them talk. Stop interrupting. Stop trying to infuse what you want them to say. They have a brain, they have experiences. Let them talk. I will never forget the very first summer session of our Peer Ambassador program, where we literally teach and train them on mental health curriculum, and then we teach them how to be facilitators of that. We were talking about grief. And we put the topic on the table, and it was about 20 of them. And that conversation went around that room so many times with different experiences that they had, both physical losses like death and other types of losses. Because when we think about losses, we automatically assume death, but that's not always true. Majority of the time, it's not true. But they took that topic and they turned it over, flipped it upside down, shared experiences. They comforted one another. They supported one another. They received support. It was beautiful. And I think that we've seen that time and time again. But in order for them to do that, I think that one of the lessons there was to create safe space, or to co-create safe space. When youth come in, we do an orientation. We set expectations. We hear their expectations of us, their expectations of one another. And I think that, there's a saying that people are contagious, almost kind of what Aubrey was saying about how healing is like within community. I think that the people that you hang with, the people that you spend time with, the people that you're around, that matters. Right. And, if you are in an environment where other people are compassionate and empathetic, and, their motto is, we don't hurt people, or we don't treat people poorly. I say that all the time. You don't know what people are going through at their homes. You don't know what they dealt with that morning trying to get there. You don't know whether the words that you're saying or coming out of your mouth is going to either push them one way or the other. So we don't treat people poorly, period. Like that is just the standard. And I think that we have to provide expectations, and then, really believe that they can meet those expectations. I think that sometimes we underestimate our youth, and we don't give them credit for being creative beings, people that can, regulate their emotions, that can, articulate their feelings and their thoughts. But we have to give them access, give them space to do that. Invite them to the table of conversation. When I grew up, I don't know if y'all, how y'all grew up. When we had like holidays and everybody came over, you had like the adult table, and then you had the kids table. The kids table was all small, and you all bunched up, and y'all eating on top of each other. We want to extend the table of conversation. We don't want to put them over to the side and tell them, y'all think over there. Y'all create over there. You only do what we say do, right? We invite them to the table of conversation, and we say, okay, you all tell us what the issues are, and then are there ways in which we can create solutions, because they are solution creators. I also think that they need to know that they are good soil. Now that'll preach every day. That they are good soil, okay? They are rich soil. And it is our job to continue to plant the seeds. We may not always see the fruit of our labors in that moment. Most times you don't. If you just think about farming, right? When you plant the seed, you don't go out Saturday to see if the fruit came. No, it is a process. You allow it to water, you allow it to germinate, you allow, the season and the time to take place. And eventually those seeds that you have planted, those seeds that you have watered, they will bring its own harvest, right? You teach a child, and by the time they get to where they need to be, hopefully whatever they need will spring up because you've already planted that thing. I think that another lesson that we've learned is that youth want to be co-healers. And I think I talked a little bit about that with that grief conversation. They not only want to be a co-healer of their own healing process, they want to be co-healers in their peers' healing process. We usually do like video interviews, and we've made 2 documentaries here at Breathe Deep. And, it gets me every single time when I hear a youth saying, I really wanted to be a part of Breathe Deep because I wanted to help somebody, even though they themselves needed some of the help that they were receiving, here at Breathe Deep. And I think the last thing that I'll say, at least for this, I'm passionate too, Aubrey. I'm passionate too. I think the last thing that I'll say about this is that we have to honor their voice. And what I mean by that is not just listening, not just hearing them or listening, because people have different definitions of what hearing and listening is, but then coupling what you hear with your actions, right? It's like saying, you know, I'm hungry, but you pray for me and you send me on my way. But what about my stomach? You hear what I have to say. You hear that I'm saying that this is a problem. How are we facilitating solutions for them? How are we showing them? You know, when you can talk it all day. But, you know, when you say, okay, you're dealing with this, let me get you somebody that you can talk to, or let me, you know, connect you with, you know, whomever that can move you from point A to point B. I lied. That was not the last thing. I'll do one more. Be prepared to pivot. You're dealing with kids, you know, and you're dealing with teenagers. Y'all remember being a teen? I got a 16-year-old, so I'm very aware of what it's like to be a teen right now. So be prepared to pivot, you know. We might think as adults that we have all the answers, right? But we don't. And when they inform us, either verbally or non-verbally, because there's a lot of that going on, we need to listen and we need to change direction in some way and collaborate with them on where that direction is going. You know, they're not the afterthought. They should be a part of creating the solution and facilitating the solution. They are leaders. They are the people who are going to be taking care of us. So if we don't do right by them, ultimately we are not doing right by us. And that's where I'll stop.
That is amazing. And I agree with you wholeheartedly. They are going to be taking care of us, right? And they are from good soil, right? And we have to nurture them, model for them, give them the opportunities to be at the table, to practice those skills that you are setting them up with, to co-heal, whether it's an adult in their lives or a peer. And I know firsthand, because I take care of teenagers, the first source they go for answers is their friends. And a lot of times I'm like, your friend don't know nothing. But in this case, they do. You are preparing them that they have a voice and they could be a part of the healing process, which is just amazing. Thank you for all the amazing work that you do.
Thank you.
All right, we're going to wrap back up to Miss Wilson. This is your second question, and it is still morning of the morning. The national suicide rate among Black youth has risen faster than any other population. How do we talk about suicide from a culturally responsive, multi-generational perspective?
Hey, so can you hear me? I turned my volume up a little bit. Hopefully it's better. Okay, great. So I think part of this is really understanding, based on what Dr. Silas Chandler was talking about, these young people are turning to each other for information. And so we want to make sure they get as much information as possible. And so we have a lot of great sources for information. We have information about Alzheimer's, dementia. So we have websites, we have a 24/7 helpline that people can call, an 800 number. They can reach out to anybody here on this panel. So, you know, bios of our speakers are on the website, but also keep that as a short list, that if you need help and you need information, reach out to all of these presenters that have been here. The other thing I think is important to understand is where stress comes from and what it leads to. As adults, as community elders, we've been some great role models in some ways, and we've been some terrible role models in other ways. So we really need to make sure that we're walking the walk and talking the talk. We need to educate young people about the long-term implications of lifestyle factors. You know, we have very high rates of stroke in the African American community, Latino communities, traumatic head injury, motorcycle accidents, alcohol use, long-term drug use, these are things that have implications for our health, our mental health, and our mental wellness. And young people don't really understand that. And as older people, we know better, so we have to do better. And we have to educate young people about the repercussions of these activities and what this leads to. The importance of asking for help and the importance of accepting help. Again, I mentioned before, we do have these great circles of friends, family, church group, fraternal groups. So we need to ask them for help and we need to accept the help. And the one thing we've learned in the Alzheimer's Association, what I've seen is that young people are great caregivers. They are really good at knowing what it is that will calm down grandmama, what will help big mama, what will help granddaddy, because they observe, they watch, and they learn. And so we have to enforce that. We have to encourage that and encourage those activities. I've run into 14-year-olds and 12-year-olds. They're the only person in the house that senior who's having an episode and bizarre behavior will listen to and will calm right down. So we have to acknowledge that and reinforce that these students and these young people are good soil. And we have to encourage them and we have to listen to them. I think we're not good at listening. Like you said, we think we have all the answers. We don't have all the answers, but we know that they have all the technology. They all have these smartphones. They all got laptops and tablets. They can find information. So we have to encourage them to do that, encourage them to come up with solutions and to validate what they're going through, the good and the bad, and let them know that that's part of the growing process and that we all have had those dark times and those difficult challenges, but we find ways through them. And if you have friends and colleagues who are negative, you need to look at a new friend list. You need the reaffirming adults in the family. We need the reaffirming friends and colleagues as well.
Thank you. And I can't agree with you more of making sure our youth have the resources, knowing what reputable sources and support are, making sure that we are able to refer them or point them in the right direction. Our job is to decrease that stigma, right? And improve access to care. And I love that you said that young people are great caregivers. They are watching, they are listening. And often when I talk to a teenager, I'm like, you stressing your mama out. What does your mom want from you? What is she upset? They can tell me. What does your mother expect from you? They can tell me. So then why are you not doing it? And they shrug their shoulders. But they are listening, they are watching, and then we need to bring them to the table as we co-heal our community. I love it. All right, Mr. Johnson, you're up next. Can you describe any cultural responsive training specific to mental health that is available at URMC for the clinical employees? Essentially, how does the institution prepare its clinicians to serve a very diverse population?
Okay, it's a very loaded question, but one that I love. So that as we look at culture responsive training, we also look at cultural responsive therapy, and we make sure we utilize that approach that's kind of emphasizing understanding sensitivity and adaptability. When we're providing therapy or providing some type of transformative healing, and we want to make sure that it transcends like the cultural boundaries, and then make sure that it involves all of our core principles, such as cultural awareness, self-reflection, and respect for diversity, diverse beliefs. And that's what therapists, we encourage them to examine their own cultural biases. I think Aubrey was talking about that earlier. Examine your own cultural biases and assumptions that will help you approach clients or our patients with a greater humility and openness. That's one way we do. We also have what we call our DICE board, which is kind of for the whole university: diversity, equity, culture, diversity, inclusion, culture, and equity, that they meet like twice a month, and they just kind of make sure that we're delivering quality behavioral health services to families and youth, and they partner with organizations. But one thing I would say that saying specifically to mental health is that to our employees, we've also had like this thing called the theater of the oppressed, is where we've had we were able to act out microaggressions and able to act out different scenes or scenarios that clinicians of color has gone through or have experienced within the clinic. And we've acted out and had full conversations, came up with strategies around that. We've had outside providers come in, outside community folks come in to talk about diversity, equity, and give some culturally responsive training. We're very make sure that our clinic, I could speak highly for our clinic to make sure that we're being intentional. I have been pushing for us to be intentional on hiring folks that look like the folks that we serve, looking at our zip codes, looking at the population, and making sure that we hire folks that look like the folks that we serve. Then we also came in with this racial justice group just to make sure that, you know, we're addressing some challenges and issues inside the clinic. And if we could do things outside of the clinic, making sure that we're doing that as well. So this racial justice groups meet like every first and third Tuesdays. And then out of that, we created lunch and learns for staff of color. Lunch and learns to really give us a space to come together to talk if there's certain things that we're facing, certain challenges, and then having an open line communication to our directors of making sure that we could take the feedback to our directors of our experiences. So we want to make sure that we focus on just incorporating inclusive language, make sure the language is inclusive, building, you know, like I said, creative affinity groups like our racial justice group and other groups, creating lunch and learns, giving lunch and learns for opportunity for folks to come in and to do cultural diversity training. We've used folks outside of the community to come in as well. And how do we prepare clinical staff to serve diverse populations? We're doing this, like I said earlier, being intentional about hiring, but also we're doing this thing now with the Resilient Roots and also culture responsive therapy. Resilient Roots, this listening session as a partnership with U of R and My Whole Family Center is where we're listening to youth between 18 to 30 that has experienced some significant trauma. And also getting their voice, hearing what they've experienced, and then talking about if they had past therapists, if they had, you know, therapy in the past, how can we take their experiences and improve for the next folks that's coming up, right? Next patients that we're seeing. So we just started creating this listening sessions so that, you know, we are evaluating this new type of trauma therapy that takes into account this unique experiences of Black and Brown youth and their families. And if it's found to be effective, we're going to report that and help meet the needs and preferences and also offer training to all of our clinicians. We want to make sure that all of our clinicians get the training. All of our clinicians understand, you know, the biases, owning their own cultural biases, and really just making sure that we train all of our clinicians and also making sure that we are intentional about cultural training, making sure that we're intentional and not just checking it off the box, not just saying we completed this, we did that, but making sure. And that's what our Lunch and Learn does. Our Lunch and Learn brings in guests, brings in speakers, brings in folks to you know, help educate us, help keep us on the right track, and also having us check ourselves, right? Making sure that we're doing things right and we're understanding each other's culture. So we do. And I'm a rapper. We do it like, you know, we do cultural bake sales. We make sure that we have minority mental health luncheons. We make sure that we had an art show of racial justice, right? Injustice. We have jackets. We sell the merchandise, and it's also talking about equity for all, equality, you know, equity for all. We have book clubs on racial equity and diversity. We celebrate Hispanic Heritage Month. We celebrate different monthly activities and then we also make sure we support Black and Brown businesses. We make sure that when we have activities that we're supporting Black and Brown businesses as well. So these are some of the things that we're trying to, you know, implement in our clinic here.
That is wonderful. I actually learned a lot what's going on under the roof at U of R, which is fantastic because this is not something that we put out on our websites to say these are all the things that we do. And this is how we can encourage the community to participate in platforms like this, to hear about what each of us are doing to prepare and to make sure that we are improving the care of our community. So thank you for all that you are doing. Dr. Makowski, you're up next. Your second question for the morning. There is an intersection between mental health, trauma, and access to the social determinants of health in the lives of many in our area. What role can a health plan play in advancing health equity across behavioral health services?
Thank you, Dr. Wilson. This is like such a big question, right? Such a big thing to try and think about. I think the things I want to focus on, trust and accountability. I'm a psychiatrist, so I'm going to say the hard things. Just thinking about recent news, people who work for health plans, I think they have a lot of work to do to, I think a lot about how groups of people continually dehumanize each other. So this is not a new pattern. And we can't really change for the better if we aren't being very intentional, if we aren't really constantly focusing on blind spots and some of the barriers I mentioned earlier, getting feedback from people, sharing information, some of that education, outreach, really focusing on our relationships. So some of this involves really frank conversations with members on the importance of mental health and supporting decisions to prioritize mental health and wellness. We have some feedback from member surveys that we get from the last one in 2022. We're kind of waiting for the next one to come out this year and update, but we know that 22% did not feel like they had enough privacy for mental health services, and a quarter didn't want others to find out they were getting mental health treatment or services. So we know stigma can really lead to delay in seeking treatment avoidance, fears of being labeled or misunderstood, a lot of feelings of shame in needing help that can be internalized. And so, that can really amplify concerns about sharing and asking for help. It can perpetuate those feelings of social isolation and can sometimes be dangerous to share vulnerabilities in some environments. It could be met with really negative attitudes and straining relationships, even discrimination. So, how safe is it for somebody to take their time away for mental health? So I like what Gerard had said, like, let's normalize this, talking in the community. When you are in a space to be a person modeling the importance of mental health and wellness, that's so important. So I think Arlene Wilson talked on important ways to support your health here. And I also love that. Mental health care, getting the right treatment and support can make a really make a world of difference. But some caregivers can't easily come away for a 15-minute therapy session, right? We hear about the lack of childcare support sometimes, and we don't often think about caregivers of adult family members with disabilities or people caring for the elderly and how do they do that. So, I'll give a little self-disclosure too. I have 3 elementary school age kids. I've got a dad navigating stage 4 cancer and a mother with Alzheimer's. So, I know that this is very difficult for a lot of people to do, to, be able to take that time and prioritize. And I also work in a community mental health clinic once a week. So we know that during COVID, telemedicine was a resource we could use, and flexibility can be huge. Post-pandemic, we still have, people who are able to use that service intermittently. Sometimes it may not be their preference, but if you have a sick kid at home, maybe that's a way to still access services in between. But we also know as a health plan, we need to keep our in-person options strong, because telemed is great for some people, but it's not for everyone. We need to have access to a smartphone or a safe space for those visits. Young kids or teens, they may really need that in-person time. And, certainly serious mental illnesses or disorders that need certain very specialized types of medicines, there are reasons where we may really need those in-person visits too. So I think that's part of the context here in trying to make sure that we have resources and, when we are as a health plan looking at what are our solutions for access, the right care for the right time, and what's going to really meet what that individual member needs. that's one of our largest areas of focus right now. So
Thank you. Thank you. Yes. And I echo the trust, the accountability, and really focusing on relationships. It would be very interesting to see what the more recent survey of health from the health plan, with that 22% having concerns about privacy, and will that change on the more recent survey? And then what, as a health plan organization, how will you address those concerns? So thank you so much for that. Mr. Scott. How can we improve opportunities to support mental health of our BIPOC and Indigenous youth and families who are surrounded by environmental stressors and violence on an ongoing basis?
Thank you for this question. Supporting mental health of BIPOC and Indigenous youth and families requires us to take a holistic and culturally grounded approach, addressing not only individual challenges, but also systemic barriers and cultural disconnections that impact well-being. Drawing from the framework of the Indigenous Health Coalition, we see that honoring ancestral heritage, championing health, igniting change can guide meaningful and sustainable solutions. First, we need to create a culturally safe and inclusive environment for healing. For many Indigenous youth and families, mental health challenges are compounded by feelings of invisibility and disconnection. In predominantly Western systems of care, one way to address this is by offering culturally safe spaces and respect that integrate Indigenous values and practices. For example, wellness programs could include traditional knowledge sharing, language revitalization, and intergenerational learning opportunities led by elders. These approaches provide grounding and build community connections that support mental health in a way that resonates with Indigenous worldviews. Secondly, we must address systemic barriers that limit access to care. The Indigenous Health Coalition has identified several critical barriers, including lack of culturally competent care, inadequate collaboration between Indigenous and non-Indigenous health systems, and data invisibility. Tackling these issues requires advocacy and partnership to ensure access to quality healthcare. This could involve expanding telehealth services to the rural communities, having learning sessions with youth, increasing training for healthcare providers in trauma-informed healthcare, and creating policies that prioritize the hiring of Indigenous practitioners who understand the unique and cultural and historical experiences of their communities. Third, we can reduce the stigma. Like Dr. Mikowski and Mr. Gerard said, we normalize mental health conversation, and it's vital. Mental health stigma remains a significant obstacle in many Indigenous communities. As one of the interviewees in the coalition noted, there's a tendency to dismiss mental health struggles or to avoid them. Addressing them altogether, community-led education campaigns can help reduce the stigma by framing mental health as a collective issue and encourage open conversations. Including youth voices in these campaigns is especially important, as they can help normalize these conversations for their peers and future generations. Fourth, data visibility is essential for informed decision-making. As the coalition highlights Indigenous communities, we often experience invisibility in data collection, which leads to the gap in resources allocation and policy development. Improving representation of data is not just about collecting statistics, it's about ensuring that data is gathered ethically with the community control and sovereignty. Better data allows us to understand where the needs are the greatest and to advocate effectively for systemic changes that support mental health equality. Finally, we must root these efforts in decolonization and resilience. Decolonization involves reclaiming Indigenous knowledge systems, traditions, and ways of healing, while challenging structures that perpetuate historical trauma. These include revitalization languages, reconnecting with traditional diets and medicines, and fostering a collective approach to healing. As the Indigenous Health Coalition emphasizes, healing is not just about the individual journey, it is a collective responsibility. By focusing on the strengths and resilience we can build together, a healthier life. More connected communities for the next 7 generations and beyond. In summary, supporting the mental health of BIPOC and Indigenous youth and families requires a comprehensive approach that combines culturally grounded systemic advocacy and decolonization. By addressing both the root cause of trauma and the cultural assets that promote resilience, we can create a pathway of healing and empowerment that honors Indigenous heritage and advance mental health equity.
Absolutely. That summary statement, that's where it's at. That's where the money is at. I completely agree. And the data piece, right? All data is not good data, right? We have to make sure we're collecting the right data, that there's integrity of the data, and that data is shared with the appropriate parties so that we can do policy changes, especially in hiring practices. And as you said, there has to be a collective approach to the mental health piece. Thank you for that. Ms. Ball, your second question for the morning. Services and treatment models within community mental health clinics are not always designed for or by Black researchers. The obvious solution is to have more BIPOC researchers. What else can institutions do or need to do in order to be more effective in designing systems of care that will improve outcomes for the most vulnerable and underserved communities?
Yeah. I see this issue as very cyclical. I think if we take apart any one systemic piece, we're going to really fail in the end goal of having more competent researchers who are from various communities. And so I'll do my best to walk us through the cycles in a quick manner. I'm acknowledging our time here. But first and foremost, I think we need more school counselors in our schools. When we think about the number of students school counselors are expected to serve and guide, it's unreasonable, even in many small and rural areas. At the higher end, one person may be responsible for guiding 500 students, for example. And there's no way you can take the time and the individual care and approach needed to be able to listen to their dreams, be able to listen to their passions, and be able to guide them on things that they might not be aware of in terms of research roles, going on to higher education and getting into these systems. Not only that, but we need role models, right? We need folks who are out there sharing this research. Research in itself is so gatekept. So many of the research articles are using jargon, abbreviations that might mean one thing in one discipline and something totally different in another, and you're just expected to know that. Or there might be a paywall or an institution wall that keeps you from accessing that information. And not only that, people aren't taught how to interpret it. So they may walk away with misunderstandings and be frustrated by these findings. And so we need role models that are out there sharing and making this data open access. Like has been said, we need to be sharing back with our community what they say, right? If we're just asking what you want and then we never tell anybody the results or do anything about it, it's very disempowering. It's another opportunity where voices are squashed. And then when we think about going on, if we want PhD researchers or whatever we need for the discipline, there are more hoops to jump through yet again. When we think about higher education, we think about SATs, ACTs, all of those admissions tests that many universities are working to do away with as a part of the admissions criteria because it's not a good example of how someone will do in the college university setting, but also those still are required some places. They cost money, the preparation costs time and money that many folks don't have. And that continues through the graduate levels. And then when we get to that point, we need mentors. We need people who can teach them about the resources because higher education, no matter how you go about it, is costly. We need places like the Rochester Area Community Foundation, who gather all of the scholarships and applications in one central place so that you can search for things that you're eligible for. And having a mentor tell you how to go about this, right? You don't know what you don't know. So having more open, honest communication, more role models, getting rid of gatekeeping practices, and having people at each level who look like the people we want to hear from, right? If it's all white men or white women or whomever, that cuts out so many people, right? People are not going to feel safe to go to a university or to go to a program, a business, where they may not feel safe or they're likely to not feel safe. So having those role models not only be there, but having the programs to elevate their careers, to elevate their learning, and to provide mentorship that's compensated to keep this cycle going. So I hope I covered everything. And no, I would love to hear more from the other very knowledgeable speakers too.
Awesome, thank you. And I echo the more school counselors. I'm all about school health and what we can do in the schools where a lot of our youth spend a lot of time. And the research language matters. We have to be able to interpret the data and results, and that has to be shared out. We can't just be gatekeepers of that information. Thank you so much for that. All right, Reverend Dr. Silas Chandler. All right, the last question of the morning. Racism is still a public health crisis. How can we focus on healing for young people while simultaneously navigating systems that continue to oppress them and their families?
Such a loaded question, my God, today. So I will start just by saying that we know that racism produces trauma. And we know that trauma impacts us mentally, emotionally, physically, spiritually, financially, geographically. And so I think that one of the things that Breathe Deep has done with, I think, families and youth is to give language. And what do I mean by that? Every profession has language. You have, acronyms that you use. There's a particular verbiage that you use. There's a particular understanding that you understand and that you can translate when someone says a particular term. You know what it means. And people who do not have that particular language, let's say you're talking to mathematicians. When mathematicians start talking about, algorithms and this, that, and the third, if you don't know that language or understand the definitions of those terms, you are excluded from those conversations. And so I think that when we talk about racism and trauma, we have to give our community language. Many times we are experiencing something, but we don't have the language in order to articulate, number one, what it means or how it feels to us, or how we can articulate that to someone else. And so when we have our summer program, we actually do daily check-ins, emotional check-ins, and we provide an emotional wheel. And so when we say, how are you feeling today? I don't want to hear good, or just happy, or maybe sleepy, right? Sometimes you get some of those. But if I might be feeling anxious, or I might not be mad, but I might be frustrated. The wheel gives us our options. It gives us other options to utilize other than the words that normally come up for us, because that's what we hear culturally. And so we were very intentional over this summer to do a trauma-informed lifestyle training. And we conducted a documentary on the impact of trauma. And so we talked about identity and culture and power. We talked about layers of power and privilege. We talked about implicit bias, marketing bias, unconscious bias, affinity bias, confirmation. And so when we were going through this curriculum, they were like, oh, that's what I was experiencing, So you could see the process of our youth, our 14-year-olds, 15, 16, right? When we go through those trainings, we know we're taking in all this information, but they are doing the same. But when they hear about race-based microaggressions, they're able to take the act of the microaggression, translate what is being articulated in that act, and then number one, be able to understand where it resonates inside their bodies, inside their minds. Like, are you saying that I'm not good enough because I'm Black or Hispanic, or I'm a girl, or I'm young, or I'm old? What is the message behind that act, right? And then that gives us the power to not react, because when we react, we feel a poke, right? And sometimes we don't know why that poke is landing where it's landing, so we react to it, right? But if I understand what is being done and I can translate that into a message, I can then respond to that, and I can say, nope, we're going to interrupt this bias act. We're going to interrupt this microaggression. And so when we give language, it really is a combination of both empowering people to be co-healers of their healing, and then to be advocates for themselves, to stop it where it's starting. If you can recognize it while it's going on, you can check somebody about it, right? Now, you don't have to do it in a rude manner, but you do it in a way that they understand, Amen. Okay, so the last thing that I will say is that when we're dealing with healing, we have to be self-aware. So we have to teach our families to be self-aware. What is it that I need right now? You know, if I'm feeling like I'm all over the place, or this particular incident has happened, or I've experienced something, it's making me feel something. So I have to stop. I have to give myself permission to stop, to pause, to breathe, and to access where I am and ask myself, what do I need right now? Do I just need to go to the next thing? Because I might just, like, you know, translate or I can't, I'm losing my words, but I might want to treat you in a manner, right, that is really, it was transfer. Thank you. I might want to transfer what I'm feeling onto someone else who wasn't even the cause of my issue, because I have not stopped to take care of myself in that moment. Right. And then to create healthy boundaries. It's okay to say no. It's okay to change your circle. It's okay to do the things that you need to do to preserve yourself. It's okay to take care of you first before you take care of other people, because if you don't do that, you cannot take care of other people in the ways in which you probably were called to do. Does that make sense? So I think that, you know, language, and then just utilizing some of those protective factors of just, you know, self-care and being unapologetic about, you know, creating space for self-care and self-love, period.
I love it. I love it. And I will say that I'm going to paraphrase something that our keynote speaker said last week. If you're in the long game, you can't be in the long game unless you do self-care. You got to take care of yourself to be in the long game. And everyone on this panel is definitely in the long game. There were so many pearls that were dropped. So before I pass the mic back to Mr. Underwood, I really just want to highlight some of the pearls, and I want to thank the panelists for an amazing conversation. I'm a pediatrician, but you people are also my people, because I love the mental health, especially when it comes to the youth. We heard today, listen and talk about your experience, that lived experience, having a theme song. We learned that circle of support, personal support and professional support, letting our youth and families knowing where resources are at. Social networks really matter, utilizing community leaders, sharing again that lived experience with mental health and normalizing it. We learned about addressing barriers at different angles and different perspectives and lenses to make sure that we have an integrated approach, about trust, accountability, focusing on relationships, understanding cultural backgrounds. We learned about the walking circles and how we can make sure we're using data appropriately, that it's integrity of data and sharing it with the community, policy changes and hiring practices, needing mentors, more counselors in schools, giving language, that community language, being co-healers, honoring our youth's voices, giving permission, let them talk, and that they are from the good soil. There's so many pearls that were dropped today. Again, thank you so much for our panelists. And over to you, Mr. Underwood.
And before you go, Dr. Wilson, and before the entire panel goes, just thank you. You know, this is our 5th year of our virtual conference, and it keeps getting better. I mean, y'all keep just raising up the bar. Like, wait a minute, we're gonna be, you know. But thank you. I mean, I learned so much from each and every one of you. And Dr. Wilson, you know, Oprah, and I'm just saying, what a masterful job. You know, I know you got 9 already, but yeah, there may be some other stuff that you can do outside of the, you know, hardcore touching, healing that you're doing, because that was masterful in navigating that time. But Kendall, you know, well, I'll come to Dr. Silas in a second. Aubrey, Kendall, Dr. Dr. Anne-Marie, Jared, this is my first time meeting you, but welcome to ABC. Thank you. We are indeed grateful. I'm thankful for the team that put this together, because, you know, we have a team of which Dr. Wilson is on. It's, you know, we need to hear some new voices, a bunch of new voices, and your powerful voices that added significant value to what we did. Now, Dr. Silas. Dr. Melly Silas, you know, I have a real special place in my everything for you, from my crown to my SOUL, that part. Just thank you, and the work that you do. I'm singling her out because for the work that you're doing with young people, is phenomenal. So Asante Sana, to each of you, that's Swahili, to thank you very much.